Hello everyone. I just wanted to share something, a question that was posed to me by one of our women's health providers. She had brought in a PAP result which stated that the patient had an atypical ectocervix, and that's all the top line diagnosis said. So she came in wondering what that meant, and I then just explained to her that an atypical ectocervix is essentially the same thing, or is the same thing as an atypical glandular cells. And so when that is seen on the pap smear, then the next step is colposcopy, or a biopsy of the ectocervix, and usually an endocervical curettage. Now, I just wanted to go through a couple diagrams that I made, and then maybe show some slides as far as what it appears like under the microscope. So, first off, just the basic anatomy. We have the uterus and the cervix, the vagina. So this is just a diagram. The part of the uterus that protrudes into the vagina is termed the cervix, or ectocervix. The portion that is just deep to that is the endocervix. Now, of course, there are farther deep into the canal is the endometrial layer, the endometrium layer of the uterus. But right now, we'll just focus on the ectocervix and endocervix. So, just a magnification here of this cervix and the vaginal canal here. So this red portion signifies the endocervix. So the endocervix, what it appears like is these columnar cells, either in a cross-section gland formation, or it can be more of a sort of a cleft, depending on the section under the microscope. Either way, it's a columnar cells or glandular cells that secrete mucus. And that's where the term endocervix is also similar to glandular or columnar cells. And so on the pap smear, an atypical ectocervix is the same as the atypical glandular cells. So the red indicates the endocervix here. The green signifies the squamous cells. So mature squamous cells are essentially stratified squamous. There's different layers to it. As the lower portion is more mature, and as it matures it becomes smaller and sheds. Now, the area where the endocervix meets the ectocervix is called the Squamocolumnar junction. So usually in females who have not experienced pregnancy, they have a higher, not necessarily higher, but a deeper squamocolumnar junction. So the squamous cell goes farther deep. Now, following pregnancy, the endocervix then starts migrating more towards the ectocervix. Clinically, this is termed Ectropion, where the endocervix then migrates to the and creates a new squamocolumnar junction that's farther out. Now, that distance, that area in between there, is also histologically referred to as the transformation zone. So the transformation zone is where we want a biopsy to be taken. Transformation zone, we can see both the squamous cells and the endocervix. This area is important because this is where dysplastic cancer can usually begin. Squamous cell carcinoma or adenocarcinoma. And so usually that's where we also see pre-malignant cells. Dysplastic cells is what we also call them. We also call them either low-grade intraepithelial neoplasia or high-grade. When that squamocolumnar junction starts migrating out, usually due to the age and hormonal status of the female, the first cells that form are metaplastic type cells. And then that's what is termed transformation zone. Anyways, let me show you under the microscope what that appears like So here you can see a cross section, and these are glandular cells or endocervical cells. They're columnar shaped and they secrete mucus. Here likewise is another area of endocervical cells. So let's see here. I wonder if we can, and then out here in this outer layer is the squamous cells. And so when we see both squamous cells and endocervical cells, this is the transformation zone. And this is what will help us to identify any dysplastic or pre-malignant cells. And so here you can see, here we can see the endocervical cells a little bit closer. And here are the squamous cells. So, yeah. Anyways, so just in brief, that's what ectocervix is, the same as glandular cells and columnar cells. So